Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. I'm going to take a moment and talk about a subject near and dear to my heart, and that's talking to your kids about cancer or any other serious issue that you may be dealing with. I do have two daughters. They're now in their 20s. They were not around when I was dealing with my cancer battle back in 1988, but for the last 18, 19 years of their lives, they have been witness to many of the late side effects that I deal with from my treatments. Regardless, whether you're dealing with cancer or heart surgery, things like that, um, you have to be age appropriate about what you tell them and how you explain things. My daughters were very young. They were 3 and 5 when I had my first heart surgery. And it was one of the scariest ones because there was no guarantee that I would survive. But you can't just hit them with the worst wording possible, which of course would devastate them. You have to be honest. You have to use simple, age appropriate language. Um, my daughters at that age already become friends with one child who had lost their father already to a heart attack. So they know that they see others have experienced that. So it wasn't too much of a shock when they learned they had to deal with it with me. So, like when it comes to, I'll use cancer as an excuse, okay? Keeping it honest and simple, okay? Using the words bad cells or lumps that grow out of control. And you have to take care of them, you have to fight them. Um, you also want to be reassuring. And as hard as it is to realize that this is what possibly will happen in their thinking, you have to emphasize it's not their fault. Kids are very susceptible to absorbing something bad happening to a loved one as something they've done. And you have to make sure that they know that it's not their fault. And also, because this stigma still exists, they can't catch whatever their parent or sibling or whatever, whoever is dealing with. Okay? And of course, you keep it to age appropriate details. Okay? You explain how the medicine fights, the cancer cells, the bad cells. Um, if they've seen, cartoons or whatever on TV where you have little soldiers and stuff like that, you can explain it. That's what it's like for the medicine to go after the bad cancer cells. And this way, that can help them absorb it a little better. You can maybe explain a little more in detail with older kids if they need it. Um, the other thing, too, is manage expectations. Okay, we're not going to tell any child that their loved one is not going to survive. Okay, but obviously you're going to have to explain to them, all these changes that are happening, the hair falling out, the nausea, for some weight gain, for others weight loss, all the fatigue. It just has to be explained calmly and very simply. It's proof that the medicine is working because that's what the side effects are. That's the chemotherapy or radiation therapy, whatever, doing its job. I will explain to you because you're old enough to understand this. The treatments not only take out the cancer cells, but they don't differentiate with the good cells. The good cells, your hair, okay, those are hair cells. Okay, that's why you lose your hair. Okay, um, another thing, make sure you validate their feelings. They're going to be scared. This is something they've never seen before, or hopefully not. Okay? It's okay to be scared. They may be angry because you can't do things as a family group like you used to. You could be sad, but always ask them, encourage them to ask questions or to talk. Okay, if it gets to a point where you need to involve any kind of like therapist to handle the really hard stuff, then do it. There's no stigma to reaching out for emotional support. And then the really important part, as best as you can, encourage normalcy, maintain it, allow them to play with their friends, have fun, support the routines, whether it be dance, recitals, football games, whatever. Um, like I said, just make sure you talk to them appropriately for their age. Obviously, like preschoolers versus school aged kids or older kids, you're going to say different things to them. You start with the basics. If you have to use props, always answer the questions the best way you can. Watch for their reactions. Okay? Prepare them for the changes. And understand it's probably not the only time you're going to have a talk with them. Okay? You're probably going to have a lot of conversations over the span of those treatments. So now I want to get into the older ages, as in like with my daughters, adult children. Okay, my daughters are now old enough to understand a lot of the things that have been happening to me. They don't recall what happened to me when they were 3 and 5. I had basically told them I was going for a test overnight, staying in a hotel, and I'll see them the next morning. That never came. I was put on an operating table 36 hours later to have an emergency bypass surgery that I may not have survived. And for the first time, I was separated from my daughters. And not only that, I couldn't hold them one more time. I couldn't hug them one more time. I couldn't tell them face to face I loved them. It was devastating for me. They didn't really have any idea. And when they were finally allowed to come visit me in the hospital, their first view of me was attached to machines, all kinds of tubing coming out of me. My older daughter was fairly curious about it, but my younger daughter was scared. Something was definitely wrong. She couldn't explain it. And she was gently lifted up onto my bed and she nuzzled into the side of my body that had nothing coming out of it. And she just laid there comforting me. They don't remember that time, I do. But as time would go on, unfortunately, my daughters were not told the truth about my health. I chose not to discuss things with them as they were happening because, it was scary times that I was constantly going to the doctor, constantly going to the hospital. But they were being told by others that your dad's all right, there's nothing wrong with him. And nothing was further from the truth. So a couple of years ago, as both my daughters were then 18, they were now allowed, I was able to talk to them adult to adult. Still not in the most extreme of details that I could have given them. But I wanted them to understand that I do still have a lot of health issues that I deal with. And during my last procedure that I had, which was an aortic valve replacement, they knew about me going for that surgery before I went in. And I explained to them what would happen and what they could expect after I was done with the surgery. And I was able to call them via FaceTime from the intensive care unit, which was a new experience for me. But they were able to see that I was okay. They know my journey is not over. Okay, they know that my health is going to be a never-ending issue. It's still one thing after another. But I'm talking to them on a level that they can understand without scaring them. And that's the important thing. Be age appropriate and keep the details appropriate to those ages. Until next time, this is Paul's Heart.